Salam and peace. This is Imam Malik Mujahid, and you're watching Muslim Network TV on Galaxy 19 satellite, Amazon Fire TV, Roku TV, Apple TV, and of course, you're on our Muslim Network TV apps on iPhone and Android. And our website is muslimnetwork.tv. We are 24/7 based in Chicago, the only network Muslim community has in North America. Well, today situation is worsening in America when it comes to pandemic. Just yesterday we had 142,755 people who have been infected, and 1,431 people have lost their life just yesterday. It's worsening situation, and hospitalization has increased by 37%. That's just in the US. Around the world, 1.2 million people have died because of this pandemic. And in the US, 130,000 have died during this period. Poor people are more vulnerable, and there is a desire to have the vaccine. Nobody is talking about medicine as much, but vaccine is being discussed very thoroughly. What does the future hold for us? I don't know, but I'm hoping good. Who is working on medicine? Who is working on vaccine? Which vaccine is good? The CDC in the United States says the goal is to deliver safe vaccine that work, with the first supply becoming available before the end of 2020. Question is, how many people will be able to access that? And CDC also say when a vaccine is authorized and approved in the United States, there may not be enough doses available for all adults. Supplies will increase over time, and all adults should be able to get vaccinated later in 2021. However, COVID-19 vaccine may not be available for children until more studies are completed. So CDC seems more hopeful. But the World Health Organization says, and I quote, "We don't yet know exactly when a safe and effective COVID-19 vaccine will be ready for distribution, but we estimate that it could be in early to mid-2021. Well, hope is somewhere in between these two statements. But to discuss that, we have very accomplished scholar, Dr. Jerome Kim. Welcome to Muslim Network TV, Dr. Kim.
Good day to you.
Dr. Kim is Director General of International Vaccine Institute, joining us from South Korea, where it is evening time. The situation in the United States is rapidly worsening. I mean, it is worse than it ever was throughout this year. How is the situation in South Korea as well as in the rest of the world?
Yes, so regrettably, in the rest of the world outside of the United States, COVID-19 continues to infect and surge in countries that had once thought the problem had been temporarily beaten. So in countries in Europe, the number of infections is increasing rapidly, and hospitals are filling up and deaths are increasing. And in countries in Asia, it's been a little calmer. The Republic of Korea, which has about 51 million people, typically has fewer than 100 local infections a day. That's still more than it was, back in the early spring, right after Korea managed to control its first outbreak. And since then, there have been a number of outbreaks, but the government here has been able to bring those outbreaks under control. So it's been a surge, then suppression using traditional testing, tracking, isolating, and treating, and then a period of loosening of social restrictions, and then an outbreak, and then more social restrictions, more test, isolate, track, and treat. And so now we're on the tail end of one of those actually very large outbreaks with, Korea now has had far over 20,000 infections and a mortality rate that's about 1.7%, pretty consistently. I think that, the big difference here is, the government understands that until there is a safe and effective vaccine, standard social distancing measures, so distance, masks, hygiene, are going to be very important. And probably the most important thing that they recognize this in official publications. They say we couldn't do this without the support of the people. People have to understand what the cause of transmission is and take steps to prevent it until we have a safe and effective vaccine.
It's just amazing. But you also mentioned not only in Republic of Korea, but other part of Asia, it has not been as bad. Is it a different type of a strain of the virus, or it is purely the people who are willing to follow the science?
No, and so initially the strain was very similar to the initial strain described in China. The second and subsequent outbreaks have also included viruses that are similar to the viruses that were circulating in Europe and North America. So the virus has gone completely around the world, which viruses will do. Air transport, contact between people from different countries. We are going to see the virus changing and mutating and spreading in different parts. We don't think it's because the virus is now immune to that the new viruses are somehow protected against the immune response or the body's defensive responses. We'll probably continue to be able to tackle this virus, but the Republic of Korea has had very few infections. 20-something thousand out of a population of 51 million. So an infection is capable of spreading. An outbreak is capable of propagating. So one of the big outbreaks in the summer was in a church where because of rain, people were crowded into the sanctuary. They weren't wearing masks, and the outbreak started and spread. And mask use is very high. If you walk on the street in Seoul, where we live now, almost everyone wears a mask. But you're wearing a mask, but when you go into a bar, when you go into a gym, when you're singing in a karaoke room, you don't have your mask on. And it's those situations that cause transmission when you're in church or in a gym.
I will come to that discussion a little more vis-a-vis some other countries in South Asia where mask and social distancing is not practiced as much, but rate is low. But let's talk about one of the major concerns that vaccine is at the horizon, and nobody's talking about medicine. Is the vaccine the solution where more investment is? Are people working on medicine, which will come later?
Oh, people are working on both. Developing medicines against viruses has always been a little more difficult, and the reason is that so let's start with bacteria, because everyone's familiar with antibiotics. We have antibiotics, drugs that attack and kill bacteria. And it's easy to target them because they're different from human beings. The problem with viruses is when they infect us, they enter our bodies, they become a part of our cells. And for instance, in the case of HIV, it actually integrates itself into our genetic material. So in order to kill the virus, sometimes we have to do things that could potentially affect the human cells as well. So the difficult part of finding antivirals is you have to find certain things in the virus that are unique to it, so that the new drugs can target just that, and they don't harm any of the human cells that the virus has infected. So a drug like remdesivir, which has potentially some beneficial effect, targets a particular part of the COVID-19 virus. Some of the drugs that we have to fight HIV, the AIDS virus, are very specific for parts of the AIDS virus that are unique, that are different from the human cells that the HIV virus infects. And that takes a little bit longer. The other thing that companies have been trying to develop are what we call monoclonal antibodies. And monoclonal antibodies are a very powerful tool. We use them to fight cancers and to fight things like rheumatoid arthritis. But again, these are biological products. They're actually things found naturally that your body makes, your immune system makes to fight off viruses, to fight against cancer and other things. And through modern biological science, molecular biology, we can basically duplicate those kinds of antibodies in the laboratory and make a huge amount of a very specific monoclonal antibody that is very specific for the virus it's targeting, in this case, COVID-19. The problem is that you have to find this protein, you have to put it into a certain cell, you have to manufacture it in huge quantities, and then you have to test it. And unfortunately, not everything we test is going to work. So like vaccines, there are certain problems that the people who are developing drugs and monoclonal antibodies face. And that will complicate their journey as well. Vaccines, they're not more straightforward. As you know, I mean, my former career in HIV vaccines, we've been looking for a vaccine since 1981, and we still don't have one. If you look at the history of vaccine development, there are some pathogens, some germs, that we've known about. We've known exactly what the germ is for over 100 years, and we still don't have a vaccine. So different types of germs are easier to develop vaccines against, and we're hoping that COVID-19 is one of those. And it turns out now, I guess Pfizer and BioNTech have been working on this for maybe 10 or 11 months, and they've come up with a vaccine that, at least over a 2-month period, appears to be very effective in preventing disease, and also appears to be safe, although we only have 2 months worth of information, and it's going to be really important to know more.
So that, yeah, that was also, I mean, there seems to be, of course, the whole world is looking for one, but there seems to be some national competition and national pride also. As soon as the German and Pfizer collaboration announced that they have 90% rate, Russians came out, we have 92% of rate. So there seems to be something of that. But when I was looking in the detail of it, it is based on the infection of 40 people or 20 people. Is it large enough of a size to give confidence? Of course, they started off by vaccinating 40,000 or so people, but it's still very small as compared to millions of people who have been infected.
Yes, and so you've hit on something that makes vaccine development rather difficult. The phase 3 trials, the trials that we do in order to show that a vaccine is safe and protects against disease or infection, tend to be very large. And we tend to depend very heavily on statistics, on a mathematical analysis of the numbers. So the reason that the FDA suggested to Pfizer that they delay the interim analysis until they had 90 infections was exactly because the FDA wanted this to be very statistically robust. They didn't want Pfizer to look when they had only 30 infections or only 60 infections. They advised Pfizer to wait, and Pfizer did. And for that reason, it allows the FDA to feel very comfortable in saying that this vaccine, we believe, really does, at least over the period that it's studied, have a 90% rate of protection against infection or disease. And that was very important. So even though the number seems small, the statistical significance is large. And that's what you want to see in a vaccine that's going to be used in general populations.
In the past, when a vaccine was introduced, what was its sample size on which it was tested and considered to be safe?
So that's actually it's a complicated question in a way. The trial that, for instance, the HIV trial that we did in Thailand involves 16,400 volunteers. The trials that are going on for COVID-19 are involving between 30 and 60,000 volunteers. So a rather large number of people. Half the people typically get vaccine and half of them get placebo. The reason we do that is that's the fastest way to get to a very clean answer. Does this vaccine protect an individual free from other biases, from infection or disease? And the numbers are based on the statistical likelihood that we will find an answer at the end. So if you are a company or the US government and you're spending $200 million to know that this vaccine works, you want to have confidence that you have the right number of people and will be able to see protection if it's there. And so, I'm not a statistician, but when you talk to the statisticians, they're able to do calculations that will tell you, you have a 90% chance of being able to get a correct answer if you use 42,000 people. And they're usually correct. And so in this case, the statisticians who designed the plan that Pfizer used to analyze the data set certain criteria. And usually the Food and Drug Administration, or the EMA in Europe, or other regulatory agencies, in Korea it's the Ministry of Food and Drug Safety, review that statistical plan before they approve the protocol, before they allow the company to proceed. Because the company, the FDA, the regulatory agency, also wants to ensure that the statistics are correct. And often, when the company says, okay, we think this vaccine is ready, we believe the data are strong, the vaccine protects against disease and is safe. Here, FDA, we would like to license this. The FDA often redoes the statistics. They do the calculations on their own, reanalyzing the data to make absolutely sure that the vaccine is working.
You're watching Muslim Network TV. This is Imam Malik Mujahid talking with Dr. Jerome Kim about vaccines, what is coming, what to hope for, and what are the challenges. We'll be right back after these messages.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! 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 Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously. It's an investment in our future. But to finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon.
Welcome back to Muslim Network TV. This is Imam Malik Mujahid talking with Dr. Jerome Kim. Now, the vaccine, which everyone is German-American collaboration, is in the news. It uses messenger RNA process. So what is that process and how it differs from the other processes?
Yeah, so there are lots of different types of vaccines, and one of the oldest would be we grow the vaccine up in a flask or test tube, or in the case of a company, in these giant stainless steel vats, and we harvest the virus and we kill it, and we then inject that killed virus back into a person, and that allows the body to make a defensive response against the virus. That's the old fashioned vaccine, and as we've become more sophisticated, we've been able to do other things with vaccines. So when molecular biology made it possible to isolate the parts of the virus that were the most important for the immune system, for the defensive system, we could express just the protein. So go from the whole virus, and that I think if you've seen a picture of the virus, there are these little like mushroom-shaped clubs that stick up on the outside. Those are our protein that are called the spike protein. Mm-hmm. And we can actually, using molecular biology, express just the spike protein and purify it, mix it up with something that boosts the immune response, that stimulates the immune system. We call it an adjuvant. And that can be used as a vaccine. So the vaccine from Novavax, which is a small American company located in Maryland, is exactly that. It's a protein and a particularly strong immune system booster. So that's a protein. Now, if you take one step back, how does the body make protein? Well, it starts at your genetic information, your DNA. And of course, there are DNA vaccines. The company Inovio has a DNA vaccine. DNA is transcribed into something called RNA. So how does it get from your cell, the middle of your cell, from what we call the nucleus, all the way to the surface of the cell? It uses something called messenger RNA. So RNA is like a messenger that takes the genetic information and tells the body what to make. This is the protein we want to make. So it's possible then, if you can take the DNA, that you can now skip the DNA and just use the RNA. which is the messenger. And that's exactly what Moderna and BioNTech have done. They've taken RNA and they inject that into the body, again with a carrier that stimulates the immune system. And that RNA, when it gets injected into your arm, gets made into protein, and those proteins stimulate a defensive response, the same way genetically engineered protein would do. So using these different techniques, a company is able to generate a vaccine that induces the correct protective responses, infection-fighting proteins called antibodies, and then sometimes, if it's a particular type of vaccine, they can stimulate what we call the cellular defense system, the cellular immune system, and make things called killer cells, which can identify and kill cells that have been infected by the virus. And so the different vaccines all have different mechanisms of action. Now, why use an RNA vaccine? Well, the process of developing a protein vaccine is sometimes a bit slow. The process of heat inactivating and killing viruses and making sure that the viruses are inactivated and then doing the testing and characterization of that new vaccine may take a long time. With RNA, we can design it on a computer. Within a few days, we can make it in the laboratory, and then we can start testing it. So it's a lot faster. And if you're thinking that for outbreaks like COVID-19, do you want to wait 5 to 10 years for a vaccine? No, things have to be done very quickly. So this is one of those exciting new technologies that may allow us in the future to respond very promptly to outbreaks. And COVID is really the first example of our identifying a problem. So the 31st of December, we were notified that there might be a problem by China. By the second week in January, the Chinese had published the sequence, which is so important because they made that information available to the world so that companies around the world could design test kits, could start designing vaccines. And the RNA companies, within 9 weeks of that, had a vaccine in humans, which is really remarkable.
Within 9 weeks, they have the vaccine at hand. So it took more time to test as compared to develop.
Yes, to actually make the vaccine in the laboratory, take it through the initial stages of characterization, make it in large enough quantity so that they could actually test it in humans. Now you're wondering though, doesn't the FDA worry about that, how fast it's been developed? So the FDA had a special review process for this because they recognized that this was going to be a problem. So they had an accelerated process for review. This was allowed for vaccines that had a safety so that the platform, RNA or DNA, or certain types of viral vectors like the adenovirus vectors that some of the companies are using, they've all been in various forms in thousands of human volunteers. So the FDA is fairly comfortable with the safety profile of RNA or DNA or adenoviral vectors already. So it was in that circumstance that they could allow these vaccines to move more quickly into humans.
Yeah, Dr. Shaheen, who leads the BioNTech, is quite celebrated all around, considering the anti-immigrant feelings all around the world, especially in the United States, that he's a Muslim coming from Turkish background as son of a very some laborer from Turkey and Germany, and he grew up to contribute in such a big way. So BioNTech contribution, he says in January we found out he canceled the vacation of his staff. They started working, and essentially you're saying it takes only 8 to 9 weeks to computers and actually develop. But then the testing process. In testing, normally people are talking about third level testing. So what are the first and the second and the third different levels of testing here?
That's a great question. So first, a vaccine is tested in animals typically. And if you're a company and you're going to spend
of course.
Right. I mean, if you're a company and you're going to spend $1 billion to develop a vaccine, that's on the average how much the companies tell us it costs. And in the failure rate going from the laboratory to licensure is 93%. So there's a huge cost and a big risk of failure. You want to make sure that as you move the vaccine along, that it meets certain criteria. So you test it in animals first. If it works in animals, then you begin to advance it into human testing. And the first stage of human testing is called phase 1. Phase 1 trials tend to involve 50 volunteers or fewer, and it really is designed to look at safety. I mean, immediate safety. Is something bad going to happen if you inject this into an adult human volunteer? And after you do phase 1, you look at the safety data, and sometimes you'll be advised by an independent group called the Data and Safety Monitoring Board. So they'll look and they'll say, yes, we don't see any safety signals here. Go on with phase 2. Phase 2 can involve hundreds of volunteers, so 600 volunteers, for instance. And you can look at dose. So can we increase the dose? And you look increasingly at what we call the target population. So, some vaccines are targeted at the elderly. Some vaccines are targeted at children. So eventually you're going to have to test the vaccine to see if it makes the correct protective responses in the target population. So phase 2 really is around getting the vaccine and looking at the target population and saying, yes, this vaccine is safe in hundreds of people, and it generates the right protective responses, the protective responses that we want to see. Does it generate neutralizing antibody, these proteins that bind to the virus and inactivate it? Does it generate killer cells? And if in the target population, you see the right protective responses, then the company will go, okay, all right, so now we're going to put down the several $100 million to do the phase 3 trial in tens of thousands of people. And those trials are designed very specifically to answer a question: is the vaccine safe? And does it protect against disease or infection? And at the end of a phase 3 trial, sometimes you actually have to do a second phase 3 trial. And so you can see the costs building up here. So as you move from one phase to the other, the companies want to make sure that the product they're taking forward is going to work. And at the end of the day, if you're convinced, if the company is convinced that there is protection and safety, then they can apply to the Food and Drug Administration in the US or the EMA in Europe for approval. And those submissions, like in the old days when I first started, it was 200,000 pages worth of documentation.
200,000 pages.
And the FDA goes through it and they repeat the analysis sometimes. I mean, that's the level of scrutiny that regulatory scrutiny that the FDA, I mean, they consider this to be their job, right? Their remit, their mandate is to have safe and effective vaccines. And so they're not going to let it go. So when the FDA was considering emergency use, they set some very clear criteria. They said, it has to be effective, but you have to have, on the average, 2 months worth of safety follow-up on all the volunteers before we'll allow you to have emergency use. So although Pfizer has evidence that the vaccine protects, they won't have the safety information for another few weeks. So the FDA, so they're not going to apply for emergency use until they have that information. Because again, the FDA said, look, this is a part of our job. It has to be effective, but it has to be safe.
Do you think this messenger RNA process is the process which is going to dominate the future of vaccination?
So for certain types of vaccines, it's going to be a huge leap forward. But there are times, for instance, and we were talking about protein vaccines for a little bit. The beauty in the protein vaccines is that they are able to generate very, very high levels of this protective antibody. And they take a bit longer to develop sometimes. And so that is the reason why they're a bit behind the RNA vaccines and the whole inactivated virus vaccines. But in the end, we may end up with wanting to have a vaccine that generates really, really high titers of really high levels of protective antibody that last for a long time. So remember now, with Pfizer, as with all of the companies that will be analyzing their data, we will have maybe 2 to 6 months worth of follow-up data. And we want people to be protected for more than 2 to 6 months. So, we're going to have to continue to watch the people in the trial, to look at the levels of infection-fighting proteins in their blood, to know whether or not we may, for instance, have to boost people, give them a booster injection, as we often do for tetanus, for instance. So there's a lot of work still to do. And anyway, the good news about Pfizer is that it's an important proof of concept for RNA vaccines. It's an important proof of concept for COVID-19, that we have now proof that a vaccine can, at least over a short term, protect against infection. That's a very important concept. And, I think you were, I don't know if you were joking, but about, national pride and things. But remember, this is a collaboration between an American company and a German company. If you look at Johnson & Johnson, which is an American company, the part of Johnson & Johnson that makes the vaccine is actually Janssen, which is a European company. If you look at GSK, which is actually based in Britain, with a manufacturing in Belgium, and it's partnered with Sanofi, which is a French company with an American research and development unit. So it's kind of hard to say that these are not an international effort. Although, yes, Operation Warp Speed, the American program, is putting $18 billion into this. And if you think about accelerating vaccine development, if you think about taking it from the usual 5 to 10 years to 6 to 12 months, you have to de-risk the process for the company, because the company is thinking $1 billion, only 1 in 10 vaccines actually makes it through. I mean, we don't want to rush things and potentially miss and do things wrong. What the government did was it said, we need a vaccine. The social and political solutions in America are not working. We're not able to get people to use masks consistently. We're having difficulty with separation, and we're having to go through these lockdowns, which have enormous social, economic, and political cost. So we need a vaccine. And how are we going to do it? We de-risk the process by offering the companies funding. And it bore fruit in the end. Although actually, this is an interesting point, Pfizer accepted no money up front from the US government.
But a commitment to purchase.
Yes, exactly.
Okay.
And that's an important commitment. So now the company knows that it will recoup whatever it had potentially invested.
Now, BioNTech and Pfizer vaccine will require for transportation minus transportation and probably storage minus 108 Fahrenheit degrees. And there are questions that type of transportation is not easily available. So what are its implications? I mean, CDC is thinking that it may be available sometime in a limited numbers late this year. Do you expect this to scale that fast, that it helps the world, or it is going to be only in the West? In certain places, it could be used?
That's actually a really great question, and it's actually multiple questions. So let's take the first part, which is the temperature. So the ultra cold chain requirement for the Pfizer vaccine, which is minus 70 or minus 80 degrees Celsius or over a minus 100 degrees Fahrenheit, is really remarkably low for a standard vaccine. Most vaccines can be kept in a standard refrigerator, 2 to 8 degrees. But the cold chain is very important. And as a company is moving forward in its development process, it will try to raise that temperature to something that is more practical. So Pfizer is working to try and raise the temperature of storage from minus 70 Celsius or centigrade to something closer to minus 20. Moderna is working to try and get that to 2 to 8 degrees. So I think they understand that the temperature may limit the applicability or the ability to distribute the vaccine on the one hand. On the other hand, there could be other innovations that become that can be used. Special cold boxes that will keep vaccines at temperature, or vaccine freezers full of vaccines at minus 70 that will be exchanged out or distributed. The supply chain is remarkably difficult, but we transport, for instance, ice cream all over the United States in the middle of summer when it's 120 degrees, and you have to keep the cold chain going. So there are going to be solutions. Maybe we don't have them all in place right away, but these are technical solutions, and the distribution and logistics are hopefully going to work. The second question, sorry, go ahead.
We will just take a short break, and we'll continue this conversation that how accessible and what else need to be developed to make it available to all around the world, where transportation and connections and refrigerations may not be available to that level. You're watching Muslim Network TV. This is Imam Malik Mujahid talking with Dr. Jerome Kim. We will be right back after these messages.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Assalamu alaikum.
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to Muslim Network TV. This is Imam Malik Mujahid talking with Dr. Jerome Kim, who is evening in South Korea, and so kind of you to spare your time for us. And share this with me that while this vaccine, Pfizer vaccine, is going to be available in America, it has challenges of refrigeration, which they're still working on. But is it going to be something which will benefit only the Western world, or people around the world can benefit from it, considering all the logistics which are involved?
So I think that it's a complicated question, and I think probably the first response should be Pfizer is the first of maybe 5 companies that may have information available from interim analyses in the next 2 to 3 months. So we would expect that Johnson & Johnson and AstraZeneca, Moderna, will also have information that becomes available, and Chinese companies as well. And we heard that the Gamaleya vaccine also has 92% protection, although no one, again, has seen any of the data. So I think that, we probably will have additional vaccines that show some level of protection. Whether they'll be the same, 90% or slightly lower, we're not sure. And whether those differences are meaningful, again, we don't know. But the governments around the world, 190 countries, have banded together to form something called COVAX. Now, there are two notable standouts from COVAX. The Chinese have joined, almost all of Europe has joined. America and Russia are not a part of COVAX. And COVAX is actually really remarkable. And it's remarkable because it's 190 countries. It's being led by the World Health Organization, by Gavi, the Vaccine Alliance, which distributes vaccines around the world to countries that can't afford to pay for them, and CEPI, the Coalition for Epidemic Preparedness Innovations, which is helping to develop vaccines for outbreaks, of course, COVID being the biggest example recently of a major pandemic. So these three organizations have convinced the 190 countries to put together enough funding to buy 2 billion doses of vaccine by the end of 2021. And that's important because 22 billion doses will allow you to vaccinate 20% of the population of the countries that sign on to COVAX. And for poorer countries that don't have an option and can't afford to bid against wealthier countries, something like COVAX will allow them to vaccinate the elderly and to vaccinate healthcare workers. So those populations that are at greatest risk from COVID-19. And that's actually really remarkable because often when we develop a new vaccine, so say we have a new vaccine for pneumonia in the United States, it takes years for that vaccine to work its way into developing countries, into low and middle income countries. So, and I always use it as an example of vaccine that we give children in America. It's called rotavirus. Rotavirus vaccine is enormously effective. In fact, after it was approved by the FDA in 2006, rotavirus vaccine uptake went to 70%, and rotavirus diarrhea in children disappeared in America. Now, in 2009, the World Health Organization approved this vaccine and recommended its use. Yet in 2020, 60% of the children around the world do not receive rotavirus vaccine, 11 years later. Now, if this were COVID, this would be a real problem. And the Gates Foundation did some modeling, and they found that if the high-income countries take the first 2 billion doses without any regard for equity of distribution and allocation according to need, then the number of deaths worldwide from COVID-19 will double. So COVAX is an attempt to fight against vaccine nationalism, to ensure that at least at some level, the needs of all countries can be represented. And COVAX is actually structured so that in the next phase, if there still isn't enough vaccine, then COVAX will purchase additional vaccine and allocate it by priority. So the countries that need it the most, the groups that need it the most, will have priority in the next round. So there is a mechanism now, and it would be great if the United States would join.
Why United States and Russia are not part of it?
So, I think part of this is
connected with the, type of President Trump's policies of isolation or nationalism, or is it some commercial interest? What is in it?
So, a part of it, I think, is probably related to WHO and WHO's involvement. But the United States was slow to join CEPI, although it recently provided some funding to the Coalition for Epidemic Preparedness Innovation, but a very small amount compared to other countries around the world, or even to the Gates Foundation, which donated significantly to this organization that develops vaccines for outbreaks. But I think, or I hope that the United States will assert its global health leadership and actually play a constructive role in ensuring that vaccine can be equitably distributed. And I say this because right now, there's a study done by Duke University, and they found that around the world, 8 billion doses of vaccine have been purchased primarily by high-income countries, have been pre-ordered by the high-income countries. So even the amount that COVAX will have, which is 2 billion doses, is dwarfed by the amount that the high-income countries have purchased. And some of it is far in excess of our need. So, for instance, and the United States has pre-ordered 1.6 billion doses of vaccine. Now, not all of that is actually consigned for delivery. Some of it is bought on contingency. And, not all the vaccine. The thought was that not all the vaccines may work. We have to make strategic pre-orders and ensure that U.S. populations will get the vaccine when it's available. So actually, Pfizer is just the first. There are other vaccine companies that are also manufacturing doses now, so that if additional vaccines are shown to be safe and effective and are given emergency use by the FDA, then other vaccines may become available. So we don't only have a vaccine that has to be stored at minus 100 degrees Fahrenheit. There may be other vaccines in the pipeline, and we should be seeing results in the next month or two. So
yeah,
there's hope.
Madura is coming up in 30 days or so. Yes. So what is, so what is the concern for Russia? I mean, America, I understand, and with the change of administration here, cooperation with World Health Organization may increase. But what is the Russia's take? Why they're not taking part? Because they think they have a capacity to go on their own for their population and provide for others?
I'm not sure why Russia doesn't participate. And the high irony here is that during the Cold War, Russia and the United States cooperated on polio vaccine, and then the world has actually ridded itself of a single human infectious disease. The disease was smallpox, and that was a joint effort during the Cold War between the U.S. and Russia. And to not have the U.S. and Russia participating in this global effort to deal with the greatest pandemic threat in 100 years is a bit ironic, and actually is going to contribute to, potentially to prolonging the epidemic and increasing the number of deaths as a result. So, Operation Warp Speed has been remarkably successful in the sense that it's moved vaccines forward at an unprecedented speed and with continued respect for safety. But it's completely inwardly focused. It, in a sense, is a vaccine for America. And what we need are vaccines that can be used throughout the world. And there's a silver lining here, I guess. Another organization besides the United States government has put $1.5 billion into COVID vaccine development, and that's this organization called CEPI. And when CEPI signs a contract with a company, like Moderna, because it has a contract with Moderna, the company signs a global access agreement and also agrees to sell the vaccine for a reasonable cost, which is important. And so a number of the companies that are supported by Operation Warp Speed are also supported by CEPI. And that gives a bit more global outlook to the distribution and equity and distribution of some of these vaccines. But it would be a remarkably important thing for the United States to assume a greater role in providing vaccines for COVID-19.
Now, one of the things I like to bring into discussion at this moment, we were talking earlier, the remarkable achievement which New Zealand had, but New Zealand is just 5-6 million people. It's like a large city. But South Korea, which is 60 million or so people. I'm a Republican of Korea, but in America nobody will know Republic of Korea, so I will keep saying South Korea.
That's fine.
And with social distancing and mask and contact tracing, that did amazing job. And what are the educational and cultural things which can be transported to other countries? Because I see the whole vaccine, which hasn't reached the people who even have invested in the West. It will take time before it reaches around the world, and more than 1.2 million people have already died. And we may be looking at another million or so, God forbid. So in that situation, things which which don't cost, but probably huge investment in education. So what are the things which South Korea has done in terms of educating people and citizen cooperating, which could itself be taken as a major preventive mechanism and spread around the country as vaccine will be spread? Because I know a whole lot of people don't want vaccine. I mean, that's another problem which is going around. But what can be done in terms of educating that? Because so even vaccine is available. It is not going to replace probably better hygiene, physical distancing, and using masks.
Yeah, so actually, all of those are important points. For Korea, so this is as an American looking at Korea who lives and works in Korea, speaking. And it's been remarkable because, Korea was, unfortunately, the victim of a different coronavirus in 2015. That coronavirus was called MERS, the Middle East Respiratory Syndrome coronavirus. And the government was heavily criticized for its response to MERS. And so what did they do? Right after that, they revised the Infectious Disease Prevention and Control Act. So they changed the law. And that gave them a lot of the tools that they felt that they didn't have in fighting the MERS outbreak. So, and one of those was the ability to, under emergency circumstances, to unify command and control at the level of the prime minister. So at level 4 emergency, the prime minister runs the response, which is really important. And the person who actually runs the response is the head of the Korea CDC. And actually it has a different name now. It's the KDCA, but it's the equivalent of the American CDC. And so from the top all the way down to the level of the districts where the health officers reside, who actually track people and who call you up to make sure you're staying at home because you're in isolation, because you've potentially been exposed, and everyone has the same message. So the messages start at the top, and the messaging is consistent all the way down to the district that I live in, for instance. Everyone knows exactly what to do because it comes from the top and goes down. In America, we didn't see that, right? We had the federal government, we had different states were doing different things. States and cities were having fights. In Korea, it's one unified command and control, the way you would in an army if you were at a war. And really, the pandemic is a war. And so that's one thing, it's unified command. And actually, when you look at Australia, which is also a federal system, they have the equivalent of states and governors, and the governors are separate from the national government. The prime minister said, okay, we need a national unity government. So he invited the provincial governors to sit in the cabinet so that there was unity of command and control. And so if you look at the successes, Australia is a success. Even though they had an outbreak and had to reinstitute some lockdowns, they were able to contain it. New Zealand has been a success, same thing, very consistent, singular control over the pandemic and response. So that's one thing. Then the testing, in Korea, they've done more than 100 tests for every positive case. And so it's like if the pandemic is a fire, you certainly know that the person who's infected, whose test is positive in front of you, is infected, but you don't know all the people that this person has exposed. And unless you're doing adequate testing, then you're not going to be able to understand the extent of the fire. So it's like fighting a forest fire, only knowing that there's a fire in front of you, when the fire is actually, miles or acres, hundreds of thousands of acres are being consumed, but you can only see what's in front of you. So adequate testing is very important. Tracking was very important. So again, it isn't that they track you everywhere, but on my phone, if there's a case reported in my district, an alert comes up on my phone that says, if you're interested, there's a case in your district, if you're interested, click on this link, and it takes you to the district office, and it's actually available in English. So it's in Korean, but if you don't speak Korean, you can read the English language version. And it'll say, there's been a case, and if you're interested, they visited this spot, and this spot. We've been able to confirm that they were at the supermarket between 10 and 10:15 on video camera footage. So then you can say, well, I was standing in the line at the cashier at 10:15 at this supermarket, so maybe I should get tested. And testing is free. All you have to do is show them the warning that you got and say, I was at this supermarket at 10:15. I think I might have been exposed, and they'll be tested free. So testing and tracking were very important. And then for big things like there was a big protest and a lot of people who were potentially infected were at the protest. So what the government said was, there's no way we can tell who was there, and people were not wanting to let other people know that they might have been exposed. So they used a special part of the law that allows the government for a period of 30 days to access cell phone towers. So they accessed the cell phone towers around the square where these 20,000 people were. They got the phone numbers of everyone who had their phone on, which is probably just about everyone. And they sent text messages to everyone saying, you were in a situation where you were potentially exposed, come in and be tested. And if you show them that little thing from the government, you get tested free. And within 6 hours of your test, you know that you're positive or negative. So this is an RT-PCR test, the PCR test that they do similar to the one in the States, but it's reported out in 6 hours. And, that kind of responsiveness and that kind of ability to let people know that they've potentially been exposed and to provide testing free of charge and have rapid turnaround on the result, again, builds confidence. The system is actually there to protect you so that you can assess your risk, you can be protected. And then the other part is isolation. So, if you're infected, we don't want you to go around exposing other people. So in Korea, they put you in what's called a residential care unit, which is isolation, essentially. And you're isolated until you're negative. And that was an important part because, part of the problem in Europe is they know who's infected. They tell them to stay at home. And if they don't stay at home, there's no way to know. And if you're infected, you are definitely have the potential to infect others. So again,
thank you so much, Dr. Jerome Kim. You have been such a good teacher for me. Thank you so much. Learn a great deal. Actually thought of a couple of ideas on which cooperation and international coordination, how it helps, how it helps. So thank you so much. Truly appreciate you sparing 1 hour with us.
My pleasure.
Thank you to you. And thank you, Sherdil Khan, for producing today's show, and Dr. Abdul Wahid for co-producing today's show. And thank you for watching. I hope you benefited from it as much as I did. You're watching Muslim Network TV on Galaxy 19 satellite, which covers US coast to coast, east to west, north to south, and on Galaxy 19 satellite and Apple TV, Amazon Fire TV, Roku, as well as your app and muslimnetwork.tv. Peace. Salam.